Hello. You want to talk about Geoffrey Rush? Yeah, I know who Geoffrey Rush is. He's a well-respected Australian actor, been acting for, how many years now? Oh, sexual harassment, you say? You want to make a class action lawsuit? Okay. And what do you want from me? Oh, you want me to testify? Okay. I really can't because I got no proof against Geoffrey. Well, proof, it's that thing that you use to, after you've accused someone, to prove that they are in fact guilty of what you've accused them. Oh, you don't have any proof? Oh, well, I can't really help you then. Because having someone guilty in a court of public opinion doesn't mean shit. You've either got proof or you don't. I've got to go. Bye. Oh, hello there. Didn't see you there. Sorry, I was just talking to a member of the Daily Telegraph about Geoffrey Rush. But I digress. Now, my video today let's talk about the Australian healthcare system and how boomers have fucked it up. Now, for those of you not in Australia, we have a semi-socialist system. So we have free healthcare to an extent, so that by free I mean you can turn up to your local emergency and get treated, but it's free in the sense that you don't actually have to pay for any treatment you received in an emergency. But in the same token of that, if you turn up to an emergency with a runny nose or a cold, it means you're going to be spending 7 hours waiting for people who actually have, real emergencies. Because in Australia we have what's also referred to as bulk billing, and that you can go to a local doctor and the consult is charged to the government. So the government pays the doctor for seeing you, and all you have to pay is the medications you've required. However, a lot of people turn up to emergency because they think that they get to see a doctor much faster than making an appointment to see their own doctor. Therefore, clogging up emergency departments because these people are complete dickheads. Now, on the other side of this, we have private health cover. So people, pay for getting health insurance, they get certain benefits and what have you. So, but private health cover only entitles you to certain benefits, and that you can claim, optical, you can claim dentistry, you can claim other certain things, but you still have to pay for the service. That's what you pay. I mean, I suppose the rationale being that you can pay, $100 a month for a service, but you still get to use a service that is equivalent to a lot more than that over a year period. But the private system is by no means foolproof either. It's not entirely bad, but there still ends up being waiting times, and people when they admit to the hospital don't always end up getting private rooms, because that's of course based on availability of rooms and the acuity of what you're actually presenting with to hospital. However, private health covers love when they can admit their members to hospital, because then the private health cover can charge the arse out of the patient, because then they can say, well, you've been to hospital and you've got these extras, and now you've got to pay out of pocket, and now you've got to pay out $1,000 excess, what have you. And so that's how to make their money largely. But you get to have your treatment immediately, whatever health treatment it might happen to be. We do have private emergency departments in this country as well, but most people don't like the fact that they are paying for the privilege of seeing a doctor immediately. But that is the capitalist system for you. So they get most indignant when they have to settle their bill before they leave the department. But they get to see a doctor. But most times the people come in and they have, not even joking, they have fallen over and hurt themselves, or they have been vomiting for the past 24 hours, and they think that necessitates going to hospital. So for all those Americans who claim that Australia, as alongside Sweden and Denmark, are excellent socialist countries, socialism sucks dick. We have to pay so much in tax. We have to pay so much in goods and services. We've got to pay so much in food comparatively to the US for the privilege of socialised healthcare. So my taxpayer dollars have to go pay for some fat sack of shit weighing 400 kilos who hasn't seen his genitals in 10 years, has been admitted to the hospital for the 10th time in the past 2 months with cellulitis, and is having to get his great toe removed because his diabetes progressed to such an extent he can no longer feel his toes, and gangrene has set in and has to lose his leg. I've got to pay for that. He'll still get admitted to the hospital though, and he'll just be the revolving door hospital system. That's what happens. So don't fucking think Australia is a good example of healthcare. It really isn't. On to my previous point of baby boomers. Now, baby boomers in this country are anyone who was born sort of after World War II in sort of mid-50s. So in the mid-50s, excuse me. Most of them are around 65 to 70 these days. Most of them are also dumb as shit. They also had the economic boom that occurred after World War II, and they had jobs for life. A lot of them, they had, if not free education, they had largely discounted education. So they managed to get themselves, double degrees in law, medicine, what have you. They also make up the major majority of hospital admissions unnecessarily. They will often be presenting with the most trivial and mundane conditions and claim that they need hospital admission to see what the hell is wrong with them. They also are the ones who deny reality when it comes to true palliative measures and the impending death, oftentimes their own impending death, and also the impending death of their parents. Some of these people still have fucking parents alive. I don't know how, but anyway. So, consider the baby boomer. Let's call baby boomer Bruce. Boomer Bruce has his mother, who's 95, can't see, continues to shit and piss herself whenever she gets up, is riddled with dementia, has fingers like this, she can't move her toes due to arthritis, but he demands she gets taken to emergency because she has pneumonia after picking it up from one of the nursing staff at her nursing home. Now, Bruce doesn't look after his mother. He has to in a nursing home because she has really serious dementia. She has to be fed by a tube going into her stomach. So, now, consider the fact that Martha has now been taken by an ambulance to emergency. Martha is 95. Because Bruce is such an ignorant sack of shit and likes to deny the reality of the fact his mother should have died possibly a decade ago, he insists that the doctors and nurses spend time and effort trying to put venous access, put a cannula in this woman to give her fluids, despite the fact she's fighting them every step of the way, because she's demented as all hell. She has a UTI because she doesn't take in enough adequate fluids, because of the peg feed. She has multiple comorbidities that would have killed her ordinarily, but she's on a garbage bag worth of drugs that are just barely keeping her alive. Her kidneys are shutting down, her liver is doing this cactus. But Bruce insists she be given every measure to keep her alive. So she stabilises, back to the nursing home she goes. She'll be back in a month's time for another bout of pneumonia and possibly the flu, which would ordinarily kill her, but because of Bruce's intervention, she won't die. This is the reality of a lot of the elderly in this country. We have no ability to work out that we need to die. You are, after the age of 65, is supposed to be the retirement age in this country. I don't know how many people I know who are over 65 and still working full time. That is a full-time position that could be going to someone who's a millennial, a capable millennial. But because baby boomers often pissed away their retirement funds, if they have any retirement funds at all, they refuse to stop working because they had nothing to finance their retirement on. So, you have little James, he just graduated high school, graduated university. He sees Bruce. Bruce is not going to give up his job in the public service. Why should he? He needs the money. He's only got 3 cars, he's only got 4 investment properties. He's only got, $1 million worth of debt to his name. Why should he give up his position? He's worked hard for that job for the past 40 years in the public service. Despite the fact his job as a project manager It doesn't actually mean much. It's one of those vacuous titles that they use to try and give themselves legitimacy. Bruce doesn't know how to use, refuses to use a computer. Bruce doesn't like those technology things. He barely even knows how to use a friggin' mobile phone, for Christ's sake. But Bruce has a job. James doesn't have a job. So James will have to be going back to Starbucks and applying for that job. Despite the fact he has a relatively good, quite a good degree and went to a very good school and is a very capable young man. So my point is baby boomers, especially in this country, have no idea how good they have it now. They don't appreciate what they in fact have, nor do they give a shit about the coming generation, which is largely my generation. So if anyone thinks that the public health system in this country is adequate or good, you are delusional. It isn't. Step into any public emergencies department, you will see it is clogged full of the elderly, drug addicts, and alcoholics. So what happens to these people? Well, drug addicts and alcoholics are taken into psych, or perhaps not even into psych. Perhaps they've OD'd. They come into emergency. They're given the antagonist drug. They're back up again. They are held for the minimum amount of time, and then they discharge themselves because drug addicts are not in hospital. Because drug addicts, they require their drugs, and when they're not in hospital, they can't get their drugs. But yet they've been brought in by emergency services because someone called them when they saw this person who had OD'd on the park bench. They thought they were dead. So emergency services, doing what the duty of care, brought them into emergency. And then you have, let's call her Pearl, little Pearl. Pearl's 45. Pearl has no friends. Pearl is an incredibly depressing woman. She's paranoid as all shit. She thinks the voices coming out of television are telling her to go eat dog shit. Pearl just needs a good slap in the face and say, get over yourself. We're not here to listen to your problems. There's people here with real emergencies and we need to get back to them. But Pearl takes up resources and time because of her anxiety and depression. So Pearl goes into the local emergency because I want to kill myself. And so the local psych registrar has to come down and admit her to short stay psych and listen to her story about how anxious she is. And really, in reality, all Pearl really wants is a sedative drug to go home with, so she can take 2 or 3 of these and continue watching the chase for the rest of the evening, and then wake up watching and spend the rest of the evening watching Q&A. And then it starts again and again and again. These are the people who fill up most of the emergency departments in this country. Don't think that most of the emergencies that come in are legitimate emergencies, because they really aren't. Of course, you're going to find the occasional car accident, stabbing, attempted homicide. It's not very common though. If doctors and nurses in that department are able to focus on these true emergencies and not having to listen to baby boomers whinge about their close to death mother who should have died 2 decades ago, this country would be a lot better off. But we entertain the notions of these fuckwits who think that they are entitled to free healthcare because they are a certain age. That's the worst thing about this country. We don't mention the fact that we have crippling amounts of tax applied to us to fund these pieces of shit in the emergency department. I mean, those who are admitted to the emergency department. And I take great personal exception to smokers who have spent nothing but the past 50 years chugging away like a chimney and then demanding that we treat them in emergency for their emphysema, or they just coughed up literally half their lung, and they demand that their cancer be treated. Fuck you. You deserve nothing. You deserve no sympathy. You do this exactly to yourself. You deserve no sympathy. That's my rant for the moment. That's why the Australian healthcare system sucks. If you wish to hear more about any Australian services, let me know and I shall make some more videos. Until next time, bye for now.